Hi everyone, I'm Meredith Drazy. I'm the Director for Physician Relations here at Reston Hospital Center. Thanks for joining us. I'm happy today to be joined by my friend Shannon. She's a birth navigator here at Reston Hospital Center. If anyone is thinking, what the heck does a birth navigator mean or do? Shannon.
Well, I am here as a resource for all of our families, our pregnant moms, to be as a point of contact on the hospital side, to be able to answer any questions that you have related to delivering at Reston Hospital and the services that we can provide. I help lead the tours and classes and just here to make sure that you feel as comfortable as possible in preparing for your delivery with us.
So we're so lucky to have her, and I know all of our pregnant patients that come through are so thankful to have her here to kind of hold her hand through everything. And because we know that no pregnancy is perfect, right? Babies are not all rainbows and flowers and pleasant stuff, that it can be scary and it can be crazy sometimes. So because we wanted to keep it real and really just talk some real talk about babies and pregnancy, we just wanted to do a little video series that we're going to be having once a month over the next couple months to highlight the fact that no pregnancy is perfect and some different things that women can encounter that might be unexpected or not really go according to plan that they had initially. So the first one we wanted to do today is about something called high-risk pregnancy. So when you say high risk, I'm sure that causes a lot of fear and worry, but that can mean some kind of normal conditions. It doesn't have to be a super scary thing. So let's talk about high-risk pregnancy.
Sure.
If you could just explain what kind of conditions would a woman find herself in where she falls into that high-risk category.
Sure. So there are multiple conditions that might make you high risk during your pregnancy. Not all of them mean that you are definitely going to have to be hospitalized during your pregnancy. So it really is a varying degree of how high risk you are with regards to these conditions. Some of the conditions might be hypertension, gestational diabetes, multiple gestation, so if you're expecting twins or triplets. Another condition might be placenta previa, or there's preterm labor, if you go into labor unexpectedly during your pregnancy. Those are some of the conditions that would deem you high risk, but again, doesn't necessarily mean that you're going to need any hospital treatment just because you have one or a couple of those.
Good. So should you need any sort of special treatment or you do require further care, we are really, really fortunate here at Reston to have such a dedicated, comprehensive team. So there is another term that's kind of mixed into the high-risk world, and that's antepartum or antepartum care. So talk a little bit about that at Reston, what we can do for antepartum.
Yeah, so we're really excited because we have 4 beds now for our designated antepartum unit. Prior to having these designated beds, we were always able and ready to take care of antepartum patients on our labor and delivery unit, but we're pretty excited to have these 4 beds designated specifically for our antepartum patients within the L&D unit. So if you are hospitalized for any of those conditions and requiring hospital care during your pregnancy, you will be in one of these designated antepartum beds. And what that means for you is that you have a very seamless coordination of care and a lot of resources at your disposal here in the hospital. So we have coordination of care between our maternal fetal specialists.
Great.
We have neonatologists that are here 24/7 from Children's National Hospital. We have your private obstetrician, and then we also have obstetricians in-house 24/7 as part of our OB hospitalist group. So we have a ton of resources for you to help keep you and your baby safe if you are requiring any sort of hospital care for a high-risk pregnancy.
That is exciting. It's always good to know that we can provide that higher level of care to those women in the community. And somebody who's had a child and been pregnant, there's nothing scarier than having something happen kind of, unexpected. So it's just always good to know and reassuring that we have that sort of comprehensive 24/7 care here.
Absolutely.
And that we have Shannon that's there to hold your hand through all of it too, which is wonderful.
Yes.
So thank you. That is such good information. I'm sure there's always questions and people are curious about stuff, or if you're pregnant or you have a friend maybe who's high risk and they're wondering kind of what to do or where to go. Please, there's so many resources that we have here at Reston. You can go to restonhospital.com and look under our maternity services there. You could, if you're just curious about pregnancy conditions that or situations that aren't very norm, you can always go to nopregnancyisperfect.com and you can hear real live stories and videos from women who have had all sorts of different experiences that nobody wants to say out loud, but it happens to a lot of people.
Sure. Yeah.
And definitely, if you have any questions about any of this that Shannon talked about today and that we're going to talk about in the future, please just give Shannon a call. She's always more than happy to answer your questions. Yeah. What's your number?
So my number is 703-639-9538. So you're welcome to give me a call. And if you're browsing around on our website, my email address is on our website as well. It's shannon.longendyke@hcahealthcare.com. I'd be happy to meet with you and talk about any conditions that are deeming you high risk, or anything anything else in terms of like how you want to plan your delivery here with us. So I'm really looking forward to meeting everyone and learning more about how you want your delivery to go.
Good stuff. All right, stay tuned. We'll be with you next month for more information on the fact that no pregnancy is perfect.
Thanks, guys.